Greetings, my name is Fee Rogers and I am an undergraduate student at Massey University doing a bachelor's degree in anthropology and education. This is a video and audio presentation discussing the work of Dr. Arthur Kleinman. Dr. Kleinman is a world-renowned psychiatrist and medical anthropologist who has taught for over 40 years in the Department of Global Health and Social Medicine at Harvard Medical School and in the Department of Anthropology, Harvard University. He was the first person to introduce the modern idea of depression into China because many of these people were experiencing or properly diagnosed with depression. Kleinman was born and raised in New York. Dr. Kleinman's medical anthropological research has focused primarily on China. He started in Taiwan in 1968 and expanded into mainland China in 1978. Kleinman has taught at all levels for decades. These efforts include educating, supervising, and mentoring undergraduates, anthropology graduates, medical students, and postdoctoral fellows. He was married to the late Joan Kleinman, a Chinese scholar and research collaborator who died in 2011 for 45 years. They had 2 children, Peter and Anne, and 4 grandchildren, Gabriel, Kendall, Allegra, and Clayton. When Dr. Kleinman began caring for his wife, Joan, after she was diagnosed with the onset of Alzheimer's disease, he found just how far the act of caregiving extended beyond the boundaries of medicine. His research focuses on cultural competency, that is a concept based on patient-centeredness that is used to address healthcare needs of socially and disadvantaged cultural groups. He uses a series of questions that can be used to learn more about individual patients, their social and cultural context. A primary focus of his work is establishing good relationships with the patients by acknowledging how the patient is feeling, what matters most to the patient, by not treating them as a statistic but as an individual. Dr. Kleinman uses the theoretical framework of cultural competence to foster cultural awareness, attitudes, knowledge, and skills. This framework uses the application of semi-structured interviews and participant observations in addressing the healthcare needs of socially marginalized and disadvantaged cultural groups. This is an inductive approach that uses explanatory models approach that appeals directly to the person as an individual, not a representation of a group. Another useful tool is the revised cultural formulation that gathers information and produces mini ethnographies. It is important that healthcare providers ask their patients specific questions to gain knowledge of patients' worldviews, culture, social context, and spirituality. By asking the right questions, like what is most important to the patient, may help to ascertain if the illness is culturally shaped. Cultural factors are central in the diagnosis, treatment, and care. Dr. Kleinman says simple interpersonal skills like having empathy and paying close attention by listening to what the patient is saying and feeling will have a positive impact on the patient's decision for the type of treatment they choose. The patient and practitioner can make an informed conscious decision on a non-biomedical treatment as an alternative to biomedicine. Modern healthcare practitioners prefer to treat the disease, not the illness, and the indigenous healers treat the illness, not the disease. Indigenous healers focus their attention on the patient's social and cultural context because each society has its own belief system with regard to treating an illness. The problems with the theoretical framework of cultural competency are the barriers like a lack of knowledge of the various ethnic and cultural groups, biases and stigmas like a set of beliefs fixed to ethnic traits, ethnocentrism, a lack of skills to assess differences, lack of organisational supports, and a perceived lack of time. Acquiring knowledge of cultural factors is important in diagnosis, treatment, and care for patients. The practitioner can make a respectful inquiry into a patient's ethnicity or lived experiences rather than assuming or stereotyping. The importance of understanding what is at stake for a patient and their families, because careful considerations are made regarding close relationships, material resources, religious commitments, and even life itself. Cultural competency uses a set of skills intended to enhance communication, adhering to ethical and moral considerations that are applied in a doctor's consultation and decision-making process. Biomedicine is a form of Western medicine used to diagnose how a disease develops, what the treatment options are, and what are the chances of recovery. Biomedicine can help anticipate the progression of the disease or illness and the side effects of treatment. A disease is a primary malfunctioning of biological and psychological processes, while an illness is a psychosocial and cultural response to disease, and is how the patient, their family, and their social network react to the disease. Our modern professional healthcare systems tend to treat disease but not illness, where indigenous systems of healing tend to treat the illness, not the disease. In comparison, both approaches consider a person as an individual regardless of their ethnicity or cultural backgrounds or differences. The theoretical approach of cultural competency uses the inductive approach that can be applied to a wide range of different cultures, but the theoretical approach of cross-cultural studies that focuses on a specific culture. From Dr. Kleinman's studies of traditional medicine in modern Chinese culture, he found that depression is socially impermissible in China. This is where his research amplifies that extreme care is needed to build relationships of trust and care. Careful consideration is needed when dealing with severely affected patients with mental illness like schizophrenia in cultures that are steeped in traditional medicine that has been passed down from one generation to the next. For example, schizophrenia in China is treated lightly as a behavior or psychological disorder that can be treated through counseling or dismissed as a spiritual imbalance of yin and yang. The problem is mental illness in China is treated like a taboo, and society view it as a weakness or shame in Chinese culture. Although schizophrenia is a serious mental disorder, and if not treated properly will lower life expectancy and an increased risk of health complications with a higher risk of suicide. The stigmatization of such severe mental disorders means that there is no psychiatric care facilities or treatment available to those from poorer areas who are marginalized, isolated, or left vulnerable. A full understanding of what is at stake here for the patient, their family, and the wider community, and ultimately their life. He expresses that care is an essential part that seems to be missing in many healthcare facilities worldwide for both biomedical and non-biomedical healthcare. Simple interpersonal skills like active listening to show responsiveness to how a patient feels will affirm who they are and that their problems have been acknowledged. Care is so central to any society because it is the hidden glue that holds societies together. In comparison, both cultural competence and cross-cultural approaches are beneficial to treat all levels of healthcare regardless of status, but it is crucial to delve deeper into a patient's social background and cultural beliefs in order to provide them with the best possible treatment available. Both approaches use similar methods to acquire knowledge about individual patients' cultural and ethnic beliefs that are paramount in effective care for each particular patient. Cultural competency and cross-cultural approach require the ability of a person to effectively interact and develop a meaningful relationship with people from various cultural backgrounds without being prejudiced, biased, or stereotyping them. The explanatory models approach and the critical method anthropology approach are useful tools that can make a major difference in acquiring the best possible outcome for treatment. These tools help strengthen meaningful relationships, provide patient individuality, and helps to build trust when patients' care is a priority. The difference with cultural competency and cross-cultural frameworks means not all cultures are included in both models, but in cross-cultural society, one culture, being the dominant one, is often considered the norm over all other cultures. This means extra caution needs to be adhered to when dealing with a dominant culture and their social and cultural backgrounds. Although modern healthcare clinicians are trained in science of medicine, are licensed to treat patients, they lack empathy and the ability to understand that some patients' cultural and social contexts need close consideration when providing any form of treatment. In traditional healing, healers are inclined to be sensitive to a patient's social and cultural context. They use natural remedies with indigenous knowledge to treat patients, although they have no formal training. Traditional healers use herbs, massage and acupuncture, when modern medicine uses chemical drugs and surgery to treat patients. Traditional healers have been in existence before modern medicine. They promote balance and use the holistic approach to healing. In conclusion, in recent times, modern clinical care has opposed traditional forms of healing, but if used simultaneously, both methods can provide benefits for patients to have the options if they choose both forms of care. It has become clear that Dr. Kleinman's work has provided alternative ways of thinking and provides tools to allow modern healthcare providers to create a link with traditional healing. Social and cultural factors are important considerations based on individual belief and value system. Clearly, interpersonal skills like active listening, empathy are human values that we are all born with, and we use them to interact with other human beings. In order for healthcare providers and traditional healers, these human values need to be incorporated into their everyday lives, regardless of individual differences, status, race, religion, language, or culture. The end.